Good day. I'm Dr. Evony Lambito Alisa Devesa, and I will be discussing anxiety and how to overcome anxiety. We have a lot of anxiety patients, especially during this COVID-19 pandemic, that they would come to the clinic with a chief complaint of difficulty sleeping, um, anxiety, palpitations, difficulty breathing, lightheadedness, feeling of choking, in verbatim, chief complaint, nakulbaan ko dok, hindi ko katulog, nabudlayan ko maginhawa, kisaga sulaba kong sulok-sulok, nga do hindi ko mapakali. So these patients are, most of the time, if we do our psychiatric examinations, they have anxiety disorders. There are a lot of anxiety disorders diagnosed in the Psychiatric Association, and we will discuss it later. So aside from the chief complaint, the folks or the family members would also claim that the patient have been observed to be very cautious, or at times doesn't want to go out of the house, or doesn't want to mingle with other people, especially the crowd. The patient would also wanted to be accompanied by the folks, and they also have difficulty going through transportation, such as public transportation, like jeepneys, also like taxi and the like. There are also anxiety that can cause a person to have difficulty sleeping, especially the generalized anxiety disorder, that there are a lot of things that person is worried about. So there can be a lot of reasons, and it will be also discussed later. Some of our patients also have the tendency to be very organized with a lot of things, and there are routines that if it will not be followed, it can cause anxiety. So now we will discuss anxiety. Please click like if this video has senseful content and it helped you or your friends and family. Thank you. So we all actually have normal anxiety. Everyone experiences anxiety, especially if we are joining competitions and other activities that we are not used to. So it can be characterized as unpleasant, often autonomic symptoms, which is like for example headache, perspiration, gabalhas, palpitations, kubag-kubagdugan, tightness in the chest, mild stomach discomfort, ang iban hambal nila do acid sa tiyan, indicated by any inability to sit or stand still for a long period of time. So these are actually can be normal, but if there is disruption, it's not normal kind of anxiety. We will differentiate fear versus anxiety. So when we say fear, it is a response to a known external definite or non-conflictual threat. So like for example, you have stage fright and you have difficulty going up the stage to perform, sing, or whatever competitions you are joining. While anxiety is an alerting signal, so it is a response to a threat that is unknown. Like for example, you are thinking a lot of things and you don't know if it's real or if it will happen. So it may be also internal, vague, or conflictual. Like for example, there is unconscious or other activities in the brain. Anxiety disorders can cause people into trying to avoid situations that trigger or worsen their symptoms, like job performance, school work, and personal relationships that can be affected. because anxiety can cause dysfunctions, especially in your functionality. So in general, for a person to be diagnosed with an anxiety disorder, the fear or anxiety must first be out of proportion to the situation or age inappropriate. Second, it hinder your ability to function normally. For example, you have fear of the crowd, and then going to the crowd, after being inside the crowd, you have these palpitations, feeling that you want to run or shout or anything that makes you feel anxious and panicky. So how common are anxiety disorders? This is according to the estimated percent of the statistics in United States. So in adults, no 7 to 9% specific phobia. This is specific phobia like fear of rat, fear of dog, fear of height, and a lot of fears. 7% social anxiety disorder. This is fear of facing people. Like for example, going up in a stage and performing in a lot of audience. 2 to 3% panic disorder. This includes like difficulty sleep, difficulty breathing, feeling of doom, palpitations, and the like. 2% agoraphobia. This is fear of open space, public, using public transportation, going out of the house. 2% generalized anxiety disorder. 1 to 2% separation anxiety disorder, and women are more likely affected compared to men. So I have already mentioned the several types of anxiety disorders like generalized anxiety, panic, specific phobia, agoraphobia, social anxiety, and separation anxiety disorder. We have here characteristics of anxiety disorders. First is separation anxiety, which is usually happening on a school age children who are going to school first time. So this is excessive fear and or anxiety about separation from attachment figures, like for example, primary caregivers or parents. Selective mutism. It is a consistent failure to speak in social situations when there is an expectation to speak. Next is specific phobia. So I have discussed it. Fear of specific objects or situations. Social anxiety disorder, fear, anxiety, avoidance of social interactions. There is cognitive ideation that is of negative evaluation by others. Panic disorder, so experiences recurrent unexpected panic attacks and persistently anxious about having more attacks in the future. Agoraphobia, fearful and anxious about public transportation, open spaces, enclosed spaces, places, standing in line, being in a crowd. Generalized anxiety disorder for persistent and excessive anxiety and worry about various events and activities. So what are the theories behind these anxieties? For psychoanalytic theories, anxiety was viewed as a result of psychic conflict between unconscious sexual or aggressive wishes and corresponding threats from the superego or external reality. So there are a lot of threats in our conscience because of those sexual or aggressive wishes. In response to this signal, the ego mobilized defense mechanisms to prevent unacceptable thoughts and feelings from emerging into conscious awareness. Because in reality, ego is actually balancing the effect of our superego and our id. In behavioral theory, anxiety is a conditioned response to a specific environmental stimulus. So in social learning model, a child may develop an anxiety response by imitating the anxiety in the environment, such as in anxious parents. So usually, like for example, if we see children who are anxious, we have observed that most of the time their parents are also anxious, and the parents are more anxious than the children. In existential theories, there is no specifically identifiable stimulus exist for a chronically anxious feeling. Persons experience feelings of living in a purposeless universe. They cannot find the meaning of their existence. Anxiety is the response to the perceived void in existence and meaning. There are also biological causes why a person has anxiety. Three major neurotransmitters are usually imbalanced, like norepinephrine, serotonin, and gamma aminobutyric acid. So these are the neurotransmitters or chemicals that are imbalanced in the brain. So anxiety is also most likely imbalances in the chemicals inside our brain. So our mind is very important and it matters. There are also what we call risk factors or the causes of anxiety disorders, which are currently unknown but likely involve a combination of factors including genetic, so it runs within the family, environmental, psychological, how the person thinks, and developmental. Anxiety disorders can run in families, suggesting that a combination of genes and environmental stresses can produce the disorders. So you may ask your parents or your relative if anyone in the family has anxiety. Nakulbaan, hindi mapakali, or that person have actually consulted a psychiatrist. How do we diagnose and treat anxiety? Although each anxiety disorder has unique characteristics, most respond well to two types of treatment: psychotherapy, most likely cognitive behavioral therapy, and medications like anti-anxiety medications. These treatments can be given alone or in combination. So, cognitive behavioral therapy, a type of talk therapy that can be helpful with the help of a professional. We tell our patients that the medications is not for a lifetime and it will not cure anxiety disorder but will give significant relief from symptoms. The most common used medications are anti-anxiety medications, as mentioned, and antidepressants because the receptors that will be targeted for anxiety and depression is the same. We can also use relaxation techniques on patients or persons with anxiety. For example, breathing meditation wherein you focus on your breaths. You count 1, 2, 3 onwards. Upon inhalation, count 1. Exhalation, count 2 onwards. Next is progressive muscle relaxation, which we can control voluntarily. Body scan meditation, mindfulness, visualization, meditation, yoga, and tai chi. So it's more of mind over matter. So we have to control or focus our mind on what is happening at the present and then not thinking of what will happen in the next or in the future, what is not actually present at the time. And to control the brain in order to control the autonomic response in the body. Healthy lifestyle is also important, like exercising regularly, 30 minutes to an hour, eat a balanced diet, more on vegetables, fruits, reduce caffeine and sugar. Like caffeine is actually can trigger palpitations and other autonomic response. Avoid alcohol, cigarettes, and drugs because this actually can trigger your body response that can mask anxiety or can be the cause of anxiety. And also, it's important to have a good enough sleep, 6 to 8 hours at night. If this helps, please like and subscribe to my channel. Thank you very much for your valuable time. God bless.